Dr. Litza. I'm an Ascension All Saints family medicine physician, and I'm here to provide some reminders and updates so we can all stay healthy together during this COVID-19. We've now been experiencing it for 2 months in our community, and there's a couple of things that we want to encourage you to strongly do now and going forward. First of all, try to stay home. Unless you have to go out for work, essential functions for the health and safety of your family or medical appointments, try to stay home as much as possible and within your family. If you need to go out, please be conscious of the 6 feet between you and other individuals. We know that 6 feet is a safe distance to decrease the exposure and transmission of COVID-19, especially when you're out in public or when you're working in a close community with other individuals. Washing your hands vigorously with soap and water with much more frequency in at least 20 seconds is still strongly recommended, especially if you're choosing to use a mask or you've been out in public or caring for someone who's sick. If you choose to use a mask, which we do encourage, specifically when you're out in public or you're working or in a situation where you cannot be greater than 6 feet from other individuals, or you're caring for somebody who's sick at home, or you yourself have symptoms. All of these situations, we recommend a mask so you can cover your face and decrease exposure that you may bring to others and to decrease the transmission of the virus. Testing is available, much more than it was a couple of months ago. So if you develop fever, cough, difficulty breathing, or just generally not feeling well, as well as for your normal chronic conditions, please call your doctor. We have increased the availability of telehealth and virtual office visits, as well as virtual urgent care if you don't have a primary care doctor. We can evaluate you, we can ask you important questions, we can provide prescriptions for treatment, as well as an order for testing for COVID-19 if you qualify based on your symptoms. Finally, we recognize that there's a lot of stress, anxiety, and depression among individuals in our community due to the work changes, the home changes, and the family dynamics that are happening as a result of COVID-19. Please take care of yourself and your family. Get exercise when you can. Relax and take a time out, especially from the news and social media. Take deep breaths whenever you're feeling overwhelmed or anxious. Avoid alcohol and drugs. And if you cannot control your feelings or your symptoms, you're not functioning very well, we urge you to please seek care. Call your primary care doctor or any of the crisis lines that are available. You can get a behavioral health counselor or therapist consult through our virtual lines as well, so you don't have to suffer alone in your family or in silence. Together, we will control COVID-19 in our community. We will take care of one another and we'll be here for one another. Thank you for all that you're doing to stay safe for yourself, your family, and our community.